Good afternoon, everyone. My name is Ashmeda, and I'm a research project coordinator at the University of British Columbia. Today, I'm here to present to you about the research study we conducted on engaging patients, family members, and caregivers in policy for primary healthcare teams integration. First of all, I'd like to start by acknowledging that I am presenting from the ancestral, traditional, and unceded territory of the Silks Nation, Okanagan. I also would like to acknowledge my co-authors who have equally contributed to the study and our funders for their in-kind support. Improving integrated health services for people who have 2 or more chronic illnesses is a challenge and is very important, as these services provide a continuum of care from preventive, curative to rehabilitative care and benefit patients, caregivers, and providers, and also the healthcare system as a whole. Primary healthcare is the first point of contact of an individual with the healthcare system, and it helps to bring health services near to where they live. Interprofessional, team-based primary healthcare models have been implemented in diverse ways in Canada to enhance patient-centered care, promote continuity of care, and improve patient health outcomes. Patient engagement is the process in which healthcare professionals, health organizations, and policymakers collaborate with people with lived experiences in order to improve the quality of care provided by the healthcare system. Patient engagement in policy development have been mentioned in various policy documents in Canada. However, there is no clear information on how these patients are engaged in the policy processes. The study is being conducted in 3 provinces in Canada, including BC, Alberta, and Ontario. The main objectives are to understand if and how patients, family members, and caregivers are engaged or want to be engaged in primary healthcare policy, and to develop recommendations and actions to enhance patient engagement in policy activities. Purpose of sampling was used to recruit participants for data collection, and participants were recruited via Patient Voices Network and Reach BC in British Columbia, Albertans for Health Research and Imagine Citizens Network in Alberta, and local health integration networks in Ontario. Semi-structured interviews were conducted with 29 participants until data saturation. The interviews were conducted to understand patient engagement in primary healthcare policy. Deliberative dialogue sessions were conducted virtually with 23 participants, and actions and strategies to enhance patient engagement in primary healthcare policy were co-developed with these participants. 4 key themes emerged from the interview data, and our first theme is patient experiences with primary healthcare teams. Their experiences were similar across the provinces, and most participants did not think there was a formal team that was caring for them, and stated that their family doctor was the main point of contact. It was also mentioned that the role of different healthcare providers in the primary healthcare team was not clear to many of the participants across these provinces. Our second theme is engagement in their own care. In each province, participants' experiences varied, and their engagement was dependent on individual care providers. The majority of participants in each province had a good rapport with at least one of the primary healthcare team members and were engaged in planning their own care. Some participants shared their experiences of not being listened to or having to make multiple efforts to be engaged. The majority of participants in all 3 provinces stressed the importance of engaging patients, family members, and caregivers in their care to improve the health outcomes. Our third theme is primary healthcare teams collaboration, and in all three provinces, very few participants were satisfied with the collaboration between the primary healthcare team members, such as physicians, community care professionals, and social workers. The lack of communication, coordination, and cohesiveness between healthcare team members was found to be a large gap in the primary healthcare team. The first three themes from the interview data set the foundation for why we need to focus on engaging patients, family members, and caregivers in primary healthcare policy. Our final theme is engagement in policy. 60% of the participants in BC, 80% of the participants in Alberta, and all the participants in Ontario had some experience in policy processes at local, regional, provincial, and national levels. Their engagement varied from co-developing programs to providing feedback, participating in health surveys, and research. It is important to note that all the participants wanted to be engaged in primary healthcare policy activities to improve health services integration through primary healthcare teams. Although Ontario and Alberta were more advanced with patient engagement and policy development when compared to BC, the barriers were the same across the provinces. There was a lack of opportunity to be engaged in policy activities, and most participants in BC were unaware of the engagement opportunities. Participants who were engaged in policy activities in BC, Alberta, and Ontario were unaware if their voices were being heard or if their feedback or engagement led to any changes in policy. There was a lack of equitable power distribution between the healthcare organizations, and most participants described their engagement in policy activities as being a tokenistic and a bureaucratic experiences. For example, patients were not engaged throughout the decision-making process, and some participants also experienced racism, sexism, ageism, and were excluded from the decision-making. The deliberative dialogue sessions in the three provinces helped us in developing the recommendations for actions. Even though there were some similarities between the provinces, the priorities were different across different provinces. Keeping patients at the center of the primary healthcare team's collaboration was the main priority in BC, whereas engaging physicians in the process of engaging patients and ensuring broad range of patient and caregivers were the main priority in Alberta and Ontario. Ensuring patient engagement that is representative and inclusive is similar to developing a core group of patients to provide their input and also ensuring broad range of patients. Some other similarities were integrating feedback from patients on policy at all levels and increasing engagement opportunities at local and system levels. Compensation was also frequently mentioned in the dialogues in BC and Ontario. Providing inclusive training for patients on policy and policy processes and health system literacy was mentioned in BC and Alberta. Other recommendations are promoting real patient engagement throughout the policy processes, engaging patients in discussion on case manager and navigator model, considering rural context for primary care networks, creating a patient and family advisory group for each primary care networks, closing the loop and offering evidence of impact of sharing the voice, sharing perspectives across primary care teams, and mandating funding tied to patient engagement. Our next step is to conduct a virtual national knowledge translation event with patients, researchers, policymakers, decision makers, and providers to share their findings and gather their feedback. The results will then be shared broadly with the public via presentations, infographics, videos, storytelling, plain language summary, and academic journals. In conclusion, patients, family members, and caregivers who were engaged in policy related to primary healthcare teams integration had similar experiences across the provinces, and it was evident that engagement opportunities should be increased, and there needs to be clear outline of patient roles and expectations, particularly in policy processes. And the barriers need to be addressed to enhance patient engagement and facilitate more inclusive representation. The recommendations for actions provide important insights into how patients, family members, and caregivers might be engaged in primary healthcare policy development, implementation, and as well as evaluation. The results of the study can be utilized to improve integrated health services delivery through primary healthcare teams and can be used to increase patients, family members, and caregivers' engagement in primary healthcare policy. And that's the end of the presentation. If you have any questions, please feel free to email me at ashmita.rai@ubc.ca.